lastly, we're going to look at abbreviations of the gastrointestinal or the GI system. So this, of course, should be your introduction into the abbreviations themselves. So of course, first up is that good old abbreviation GI. The G stands for gastro, which means the stomach. The I for intestinal, which is both small and large intestines. Next up, we actually looked at gastroesophageal reflux disease in the disease section. So please go back and take a peek at that if you need to. But it is very commonly abbreviated GERD, and you're going to hear most healthcare professionals just call it GERD for short. So when a doctor or other healthcare professional says GERD, they're talking about that reflux disorder. Next up, we also talked about peptic ulcer disease, or PUD for short. Okay, so you can just use the first letter of each of the names in the disease to refer to it. All right, I did mention the acid in the stomach. The type of acid we find in the stomach is hydrochloric acid, which is abbreviated HCl. All right, so some of the medications we use, you will see it in this chapter, you'll see it in some future chapters, is non-steroidal anti-inflammatory drugs. I am sure you've taken some of these. Things like Tylenol, aspirin, ibuprofen are all different types of non-steroidal anti-inflammatory drugs. The abbreviation is just the first letters of each of these, so NSAID. And again, just like GERD, we're really going to call this NSAIDs. So if you are looking at a drug and somebody says they're taking NSAIDs, this is what it refers to. And then we also have NG, which stands for nasogastric tube. So it is a tube that goes up through the nose, right, is fed up, and it attaches to the esophagus and goes all the way down to the gastro portion, which is the stomach. Okay, this is if we have to have a patient who is not allowed to eat, but we still need to get nutrients in. We would do it through a tube that is fed up through the nose. All right, take a look at all of your abbreviations for this unit, and good luck.